So one of the areas we want to look at specifically was primary care visits. So what's wrong with primary care today? There's a couple of things. There's a lot of wasted time, and there's a lot of distractions in each appointment. So we're looking at solving both these problems with a simple, sort of streamlined solution to knock out each of these. We can get into the details of what this means in terms of impact, but we think that it's reasonable to say that we can save 60% of time that doctors spend on low-level activities, such as transcribing and reading information, and generate real impact for hospital systems. Poor patient satisfaction is also another major driver for profitability in the future for hospitals, and so we think a more engaged patient-doctor interface is a very beneficial thing. So how does Vidrio help? Vidrio captures audio and visual information from each of the primary care visits, and in the back end, it automates some of the simple EMR updates and also transcribes the doctor's notes so you can go back and update these clinical notes post appointment. What's the value prop? 1, it streamlines documentation. 2, it improves the patient experience. 3, it captures visual cues. And 4, it improves the quality of data that you're capturing. Thanks for listening. I'm actually not feeling so good right now, so I'm gonna run my doctor right now.
Hey, I'm Dr. Rowe. Nice to meet you.
How's it going? I'm not feeling so well. I was giving this presentation, and I started getting a little bit lightheaded. I started feeling some chest pains, and I'm not feeling so well.
Okay, so record, start visit, and your name's John Rodley, is that right?
I'm John Robbins.
Great. So it's really concerning to me that you're having these complaints, hypertension, chest pain. I'm going to quickly look at an EKG snapshot. I'm concerned. I think that you might be having what we call acute myocardial infarction or a heart attack. I think we're going to give you some medicine, and we're going to send you right to the hospital and visit. So that's our visit.
And so, any luck, stuff is popping up at the bottom.
Yeah, there you go.
And if you have downtime, there's someone else that can get you more patients.
Yeah. So we've gone again from taking Google Glass and creating software that pulls a clinical experience onto an open source EHR in less than 48 hours.
And so we coded a few basic examples. Essentially, it's audio recognition of certain keywords to trigger the system in the back end to start capturing relevant information. So anything that's sort of a simple update in the EMR system can be done fully automated, and anything that's a bit more complex, like the physician's synthesis of all my diatribe of what's going wrong, it will capture and transcribe those notes that later, maybe 80% of that is pre-populated for when it goes back.
2 minutes of Q&A?
Yes, a question. These might be some of your questions.
Wow. Yes. Great presentation. Where do you think Google Glass falls down? What are the limitations in your mind? I mean, you said sort of deep clinical notation, but anything else you think?
I think there's different phases. Like early on, it's getting over a couple hurdles of like patients being comfortable with this sort of new mechanism of conversation. Technically speaking, I think that's in later versions, I think there'll be hurdles to get. But right now, I think for a simple, that's kind of why we started with primary care visit. We don't actually see too many technical constraints.
I mean, again, to get to your point, you're trading a little bit of a barrier of talking kind of into your computer all the time during the visit to a little bit of a barrier here, although less so, and then this barrier of injecting words into conversation. It might not feel so fluid, although with more time, I think that we really could develop trigger words to pull things in more seamlessly.
And right now, the trigger words are very basic, but maybe we can think of, even when we get into the ideas of altering the doctor's workflow as well, certain words will trigger the next sort of set of questions, or based on information that he's receiving, we'll have, certain dynamic pathways that then trigger something that he should respond with. Right now, obviously, we just want to come up with a basic, sort of vocally activated mechanism.
How does this complement or compete with Nuance and what they're doing?
We would use Nuance.
Okay.
I don't want to compete science-wise with Nuance.
Right.
They're killing it, and so if I can use them, I'm happy now.
Also, Nuance doesn't have any ability to enter multimedia, so we're able to really capture relevant video image data, and Nuance can't do that.
Okay.
Any other questions? We have a few seconds.
Great job.